Hello, it's Dr. Rhonda Johnson. Today's Tuesday, October 5th, 2021, and today I'm going to be talking about COVID versus flu. As I mentioned yesterday, flu season is here. How do you know whether it's going to be COVID or the flu? Well, folks, it is not that easy to tell the difference based upon your symptoms. First of all, you have to get tested. Doctors will have to order a test to distinguish the flu from COVID. Now, you don't need a doctor's prescription to get a COVID-19 test, but currently you have to to get a flu test, it has to be ordered by your healthcare practitioner. Now, people who can be infected with COVID and the flu at the same time and have COVID-19 and flu going on at the same time, and folks, you don't want that. Because, again, COVID has caused more serious disease in many more people since this pandemic began. Now, what are the symptoms of COVID and flu? Well, both COVID and flu can cause fever, chills, sore throat, congestion, runny nose, headache, body ache, tiredness, and cough. Nausea and vomiting and diarrhea can occur with both flu and COVID, especially in children. But only COVID seems to cause a new loss of taste and smell, and usually only COVID progresses to severe shortness of breath and difficulty breathing, particularly with this Delta variant, quickly in this disease. Now, what about contagiousness? Well, for both COVID and flu, you can be contagious 1 to 2 days and spread the virus before you have any symptoms. Now, when do your symptoms usually start with the flu? Typically, they start from 1 to 4 days after you catch the flu. But COVID-19 symptoms can appear anywhere from 2 to 14 days after you're exposed to the virus. So that's why they say quarantine is ideally 14 days. Now, adults and children with flu appear to be most contagious again in the initial 3 to 4 days of their illness, but for the flu, people can remain contagious for 7 days, and I already told you can be contagious with COVID for 14 days. Okay, now, who is more likely to have more serious disease? We talked about this yesterday. People who are 65 and older, children between the ages of 6 months to 2, and then children 2 to 5 years of age. Now, again, you can't tell them apart clinically many times. They're both highly contagious respiratory illnesses. You can both transmit infection before you even know you have COVID or flu. Is there anything different, you may ask, about these two respiratory viruses? Well, there's a major difference. A major difference is in treatment. Now, I first want to acknowledge that most people with the flu or COVID have mild illness and do not need any medical care and can be treated at home with symptom management. But there are people who need antiviral drugs to treat the flu. And these are people, again, that are at higher risk for developing complications. The good news is that there are 4 approved FDA prescription medications that are antiviral drugs for the flu. Again, they have to be prescribed by your doctor. Now, these 4 drugs for the flu, they can be given anywhere from orally by a pill you swallow to inhaled as a powder, or even given once by IV through the intravenous route. Again, they're given different ways. The doses are different. The drugs are approved for different ages. That's beyond, the scope of this talk, because again, you need to be under medical care to be treated for the flu. Now, for COVID, the situation is very different. We only have one drug, remdesivir, that is approved by the FDA to treat COVID-19. And then we have these other emergency use authorization treatments by the FDA to allow healthcare providers to use treatments which are not yet approved. Many of them have other uses they're approved for, but they're being used to treat COVID-19. One of them is that REGEN-COV, which is a monoclonal antibody treatment, which I fortunately received. It has to be given to people at high risk, at severe and progression for COVID and death. And it can be given to pediatric patients 12 and up and adults. Again, it's injection or IV. Now, recently, the U.S. global pharmaceutical giant Merck applied for emergency use authorization for its experimental drug for COVID-19. It's called molnupiravir. Molnupiravir. Got to say that one twice. It was developed originally for treatment of influenza. It's an oral pill. It's given twice a day. You have to get it early in the disease in the first 5 days. And in this original clinical trial of about 755 unvaccinated people who got COVID, this pill reduced by 50% the chance of hospitalization or death for people at risk of severe disease. Now, this drug, molnupiravir, works by messing up the way COVID-19 virus genetic material replicates. It prevents viral replication. And again, the challenge with any antiviral treatment for flu or COVID is that they have a narrow window in which they can be given and still work. Once the virus has replicated and produced billions of copies of itself, it's too late. So the other thing is that because this is a genetic, messes up genetic replication, this new drug, molnupiravir, won't be given likely in pregnant women. And pregnant women are one of the highest risk groups for both flu and COVID. So let me spend a minute talking about pregnant women here. Pregnant women, because they have changes in their immune system, their heart, their lungs during pregnancy, they're more prone to severe complications from the flu and COVID. Again, right now, doctors are sounding the alarm for pregnant women to please get vaccinated for COVID-19 and flu. Okay, so pregnant women, get the flu shot. You can't get the nasal spray because it's a live weakened virus. And again, breastfeeding moms should get both COVID and flu vaccines to protect themselves. Your babies need you, moms. They need you for all of their lives. We don't want to lose you to COVID or flu. All right, so what can we do to prevent COVID and flu? Prevention. Using the multi-layered approach, using your mask when you're outdoors. Get vaccinated, folks. Get the flu vaccine, get the COVID vaccine, and they can be given at the same time. Just get them in different arms. Still avoid high-risk places, poorly ventilated places. Get those windows open. Try to have some cross ventilation and wash your hands and socially distance. You guys know what to do. Now, there are many unknowns about this 2021 to 22 flu season. Last year, we didn't see much flu, but who knows what the future holds for either flu or COVID. But again, do everything you can. The best flu infection and COVID infection, trust me, is the one that never happens. As always, my views are my own. Stay safe, folks, and have a blessed day.